good afternoon. I would like to welcome everybody to the special board meeting of April the 19th, 2021. I would like to begin by acknowledging that we are gathering here together today on the traditional land of the Blackfoot people. First on the agenda is to approve the agenda. I'm not sure, Leanne, if you're able to put that up on the screen so we're all able to see that. Oh, it's on the side. Oh, thank you. Sorry. Thank you. No, I appreciate that. I didn't see it in front of me. So we have the agenda before us. Are there any additions to the agenda? One thing that I would like to add as the new point number 4 is I would like to have discussion on bringing forward an education piece on curriculum and just providing opportunity for feedback on curriculum to our community group. So if we could put that as the number 3, I would appreciate that. And if seeing no more additions, if we can have a motion to approve the agenda. Thank you, Jan. Call the question, all in favor? So moved. All right, first on our agenda is our COVID update. Cheryl.
And so to review the COVID update, we'll have put up on the screen our considerations for change discussion guide. I just want to, we've discussed this before, the entire discussion guide does not get posted with the minutes, nor does it get posted on the website because for 2 reasons. It contains charts and graphs from other sources that would not be our right to publicize in our form in a discussion guide because we draw from a number of different sources, including the City of Lethbridge and Alberta Health Services for some of these graphs and information. But what we do at the end of the board meeting, as we did last board meeting, is provide a summary on our website. And so by sometime tomorrow or Wednesday, a summary of this discussion will be on the website. And so if we, okay, so if we go, and I'll be asking Morag, Associate Superintendent Instructional Services, to provide assistance with this as well as Mike Nightingale, Associate Superintendent, for some of these areas. So when we take a look at the first page, has Alberta Health Services provided any new direction or guidance? Yes, of course, as the public knows and as board members know, we've gone back to step 1 due to the sharp rise in cases across the province. And so the steps remain the same, although the province has Chief Medical Officers indicated that benchmarks are looking different, not just hospital states, but also taking a look at a number of factors, including the increase in variants and so forth. If we scroll to has additional information, data.
She can't see the document currently on the TV, so it's not on the TV, it's on the side screen.
So, Morag, if you go into OneDrive, you'll see the document there.
Okay, no problem. Just make sure you're referring to what section you're talking about. Sure, that'll be helpful.
I will. Yeah, so I'm on page 3 now, Morag, as additional information data regarding the pandemic. And Morag, because Tyler's on Teams, Tyler, you may not have a copy of this, am I correct? Could you email that to Tyler?
You are correct. I do not have a copy of it. So.
Right, we'll have Morag email you a copy, Tyler.
Okay, thanks.
Yeah, I'll do that shortly here, Tyler.
Thank you. As additional information data regarding the pandemic, so page 3, you have a chart there that's taken from Alberta Health Services, well, the COVID Alberta website, and as you can see, the climb in the variance. This chart is current data share on increasing of variance. So if you take a look at beginning of January through to where we are now in April, we had our spike a few weeks ago, and of course it's been high but variable over the last few days. And has Occupational Health and Services provided any new direction or guidance No. Oh, I missed that Alberta Education provided any new direction or guidance. I just put in there that it can be noted that the Alberta government did move grade 7 to 12 in the city of Calgary to scenario 3.
Also, Fort McMurray and St. Albert also. And Albert schools are doing the same.
So St. Albert Schools on Fort McMurray, grade 7 to 12. Yeah, thank you, Christine. For a period of 2 weeks or longer. And actually that's a good opportunity to take pause, and I know at the Division School Council, I took the opportunity to help parents understand and the public understand how those decisions are made, because I think that, you know, certainly from the communication I get and perhaps the communication that board members get, that there might be people who are under the assumption that it's the superintendent or board who decides to move an entire school or an entire school division to scenario 3. As board members know, that's not the case, that moving to scenario 3, an entire school or an entire school division or part of a school division requires ministerial approval. And so what superintendents do to receive approval, and we have received approval in the past. Before Easter, we had approval for Galbraith Elementary School, and we had approval for Winston Churchill High School, and Amanda Christian Elementary School and Amanda Christian Secondary School. The process for that is connecting with the Deputy Minister's office, the Office of the Deputy Minister. We're asked to fill out a template and provide all of the data regarding number of positive COVID cases in that particular school, number of and broken down by students and staff and support staff, number of individuals in quarantine, and then they look at other factors such as some history of trending and so forth. And so certainly before we returned from Easter, the Holy Superintendent myself actually spent both days over the weekend prior to return connecting with the Deputy Minister's office, and we did not receive approval to move schools to scenario 3. The Deputy Minister's office felt that our numbers didn't warrant that movement at that time, but they committed that they would certainly be open to ongoing review as we move further into April. So it's not the board or the superintendent who makes that decision, it's the Deputy Minister's office. That's
And I appreciate you clarifying that. I also think not everyone's going to be watching this meeting today, and I'm just wondering if there's a reminder or something could be put out to the public, because even on our school council meetings, not even some of the information coming back, I sat in some school council meetings, and that information was not presented. So I think it's important that our community, like Lethbridge itself, understands that there is a protocol. It is not our individual decision, even though we encourage it or we, ask for that. If somehow we can put that out and just to cut down on a lot of misconceptions.
Thank you, Doug. And you're right. There is quite a bit of misunderstanding, and I can appreciate why, because certainly there may be many parents and community members who think that the superintendent or the board have the authority to close the school and move the school to scenario 3, but of course we don't have that authority. And so as part of our public information from today's meeting, perhaps I'll make sure that we have our communication officer, and I'll work with him to put something on our website regarding processes for moving to scenario 3. Yes, thank you for that, because I would agree there is some confusion with respect to that. And I know most recently this week I've had questions, why did Calgary move to scenario 3, grade 7 to 12, and Lethbridge didn't, right? I've had a number, and you may have had those questions as trustees as well, and so certainly we'll put something on our website that helps, that you can point to if you get asked that question, that points to process for that. Other guidelines recently, ASAA did communicate that there won't be competition in any sport for the rest of the year, and then the rest basically remains the same from ASAA. I'm on page 4. Community transmission rates were updated. Big thank you to Christina, who works with Morag for updating all of the charts and graphs for this afternoon. And so it's very up to date. So as of April 18, 2021, Lethbridge had 462 cases. The last measure was April 4th with 515 that we reviewed. As of the 19th, Lethbridge gained 459. We were at one point the highest. We are now the 7th highest. That doesn't necessarily mean that we've dropped that significantly. That also is because others have risen that significantly. And so that's the case there. Page 5 is the active case rates per 100,000 for major cities. And if we take a look there, again, we've got our color is green. We've stayed fairly steady, a little bit of a drop over the last 4 days, not significant, but still of a drop. So that's certainly encouraging. Grand Prairie has skyrocketed and leveled off. And of course, we had Calgary go up as well as Red Deer and Edmonton. It's interesting because Lethbridge saw its increase a little bit earlier in March. And so, you know, what will happen over the next few weeks is still to be seen, of course. And if we turn to page 6, that's a 1-week daily case trend. And then underneath that is our 4-week trend. So certainly up and down. And part of those peaks and then absolutely nothing is because those would be the days, of course, the nothing would be days that they haven't provided, they haven't done the testing or the testing result of those days. Page 7.
Cheryl?
Yeah.
Just an important piece to remember from the data just on page 5. Given that it is mostly or predominantly the variant that is presenting now and it is more contagious, I think it's important for people to understand that that 459 it is still quite a concerning number, as more of the variant is the UK variant as opposed to the original COVID virus.
Thank you for that, Morgan. That certainly seems to be some of the nervousness that is being felt certainly across our parent population as well as our staff, right? That the concern with the co-variants. So we have our daily cases, as I said. We turn to page 7, active cases in Lethbridge, and they remain high. And as Morgan just pointed out, certainly a concern because they do remain high. And as Morgan just pointed out, many of those are the covariant, and so certainly with the known easier spread of the variant, it will remain a concern until we see a dramatic drop in numbers for sure. Page 8 gives you the active cases counts per school as of April 19th, and so this would be, Morag, tell me if I'm incorrect, this would be in terms of active case counts over the past 2 weeks, help myself and board members interpret the number of cases.
So we use the Alberta Health Services definition around active cases, right? And it considers that 2-week window of being active as a case, and then it expires. So within that 14-day window of being identified.
Right. And so over the last while, as defined by Morag, certainly Churchill has gone up and Chinook has gone up. And actually, Chinook also has a number of cases that were what Alberta Health Services called the heads up, where it didn't affect quarantine or other people in the school, but students being kept at home. And there's another 15 that have been sent over the last 10 days regarding Chinook. So certainly our secondaries seem to be experiencing more of the numbers most recently. And actually, Tracy from Churchill is going to give me some further, Tracy Wong, principal of Churchill, is going to give me some updated data at the end of the day today, so that we can take a look at where we're at with Churchill. And the mandated staff in schools isolated or quarantined due to possible exposure to school, yes, and I don't know if you have anything different there, Mike, as of today.
I can add a little bit. Just as a reminder, those are total numbers. So in March, it was a total of 200 staff members that were mandated to isolate. April, the numbers are still just coming in. Just a bit of information for you. We would have been down to probably one staff member mandated to isolate at the end of last week. After this weekend, we've now got 23 that are mandated to isolate. So the point there is the numbers change very, very quickly. We can go from looking pretty good to all of a sudden you've got some challenges. So far we've had probably in the neighborhood of about 500 instances of staff members being mandated to isolate. About 70 of those have been staff members have been mandated to isolate multiple times. So.
Thank you, Mike. And in terms of students, at the top of page 9, in March, as you can see, the number was 25. And in April, up to April 17th, 685. I would suggest after today that number is going to go up quite a bit because we've had 4 or 5 high school classes affected. So we'll see that number go up somewhat, or not somewhat, it'll probably rise quite a bit by the end of today. Contact tracing in schools, yes. Evidence of COVID-19 transmission within schools, yes, there has been some evidence of that. Not considerable numbers of cases, but there has been some evidence of that happening. Nothing new with insurance. Student absenteeism. It's interesting because there's a lot of anxiety around that, and actually my discussion with one of the high schools now, one of the high schools has as many students absent as there are quarantined. Because parents are saying, well, actually the students who are high school are saying, the last thing I want to do is get quarantined for 2 weeks. I would rather not come to school because I'm going to end up being quarantined, because of course some of those students have had that experience on numerous occasions. And so the absenteeism rate, once cases start to go up in the school and more classes get quarantined, especially our young men and women in high schools begin to consider or weigh sort of what it might mean for them to go to school, right? And whether or not they'll be quarantined, not necessarily have COVID transfer to them, but the whole quarantine piece, especially those students who have had to quarantine on numerous occasions. How does students' absenteeism rate compare? I don't know if we updated that piece. Yeah, April 15th on the bottom. Right, okay. Yeah. So yeah, we've had 0.7 up to April 15th. And so yeah, we've had it's interesting. So you wouldn't think that that's significant, you know, as a result of COVID, but of course it comes in pockets, right? It's the challenging piece. And there's a write-up there. I'm at the top of page 10. Staff absenteeism. I don't know. I think Mike might have covered that a bit. Is there anything to add to that piece, Mike?
Well, the numbers. I think the numbers on page 9 kind of illustrated. You know, essentially, yes, we've seen more absenteeism. We have been more effective in managing it than we anticipated, but it still creates challenge. Our teachers have become very adept at moving online and back in person, but that's taxing on people, and it's not optimal. But staff do the best they can.
Do we have enough substitute teachers and non-certified substitutes? Right? Maybe I'll turn that to you.
Yeah, I can turn that one over. We've done okay this year on the teacher end of it. We were starting to struggle in November when numbers were very high. Once we went online, obviously that was less of an issue. We were struggling again in mid-March when our numbers were very, very high, and there were times where absences weren't getting filled with teachers. Support staff has been a challenge ongoing. That's even typical in a non-COVID year, but the problem has been exaggerated this year. So to give you a glimpse, today we were at about 13 educational assistant positions that we could fill, one administrative assistant, and we're looking at 2 teacher positions that we probably weren't going to be able to get filled. We had 5 at one point, but I think we got 3. So that would be, normally teachers were, most days were covering, but we're kind of right on the
Caretaking staff, I believe that we're still in good order there, Christine. I believe it's the same. The pivot points are done. Probably one of the biggest challenges schools are experiencing right now is it's challenging for them because they're getting requests from parents, even though there isn't a pivot point, to deliver instruction to at home. And so we do have a number of situations where staff are doing their very best to do both, and that's very challenging for staff because that was certainly never the intent, right? And that's why we had choices and pivot points. And so I know that staff are working hard trying to accommodate families, family choices and children, but there's in some situations there just isn't that possibility, of course. And I know schools are working really hard to do what they can do for their students. Yeah.
Cheryl. And so the 2 pieces there that really exemplify that challenge, one of them is when, and now we know our kids are staying home more often when they have the sniffles. They've never done that before. And so when a student stays home for a couple of days, but is still able to do schoolwork, they're asking the teacher to provide work or connect with them, right, online. And then the other piece is when there's a community transmission and a child is identified as a close contact, then they are at home, again, for that 2-week period and requiring some kind of academic support. So those 2 pieces alone really do layer the amount of work that teachers have to do tracking and making sure these kids are doing all right.
The outside agencies currently delivering services, I believe most of it remains virtual. Would I be correct in saying that?
Yeah.
And overall, have schools, so on the top of page 11, as schools communicated that they support change and have the capacity to assume additional responsibilities that come with co and extracurricular activities. And as you can appreciate, there's always a range of perspectives, right? So I try to synthesize and represent in this monthly report or bi-weekly report the kinds of things that I'm hearing. We did visit with our secondary administrators to get their input, and we've been touching base with elementary as well. And so at the middle school level, the school administrators indicated the following. It's close to the end of April and all potential school sports are finished, and that would be the case in a regular year. Students are getting more outdoor activity than in the past, built into the day with breaks outside, and when possible, PE outside, for example, experiences for track and field. Middle schools indicated they have not had pressure for offering any activities since the rise in cases in Lethbridge. The most significant concern of parents is the number of times their child has had to be in quarantine because of a case in the class. That seems to be the dominant parent concern communicated at the middle school level. At this time, with only 8 weeks left of class, middle school administrators would like to focus on planning for the fall. Not knowing what the scenario will be, they want to start planning for a cohort model that can transition back to regular access, with activities built in over a period of time as the situation allows. So that's sort of the feedback from middle school. High school continued to contend with the myriad of complexities that come with quarantine classes and delivery of learning when this happens. And so, as you know, a student, if there's a positive student, a student tested positive, that student typically has 4 classes, so there's 4 cohorts of students that are affected, and the staff members perhaps in that class as well. And so it does become complex for delivery of learning because if the teacher is quarantined, then they've got another 3 classes or 2 classes that they're delivering to. And so it is complex, but I have to say the schools are doing incredibly well with being able to transition to online without interruption in learning. Teachers have become very proficient with delivery of online learning, but it is stressful to be quarantined and switch delivery on an ongoing basis. And as Mike has said, there's some staff who've been quarantined on numerous occasions. There may be room for online activity, but it must be kept in mind that we are near the end of the year. They would not want staff to feel that they had to assume responsibility for after-school activities, even if online, when they are having to spend a lot of time with pivoting instruction back and forth to in school and at home. And for some, teachers are doing a combination of both in school and at home. There may be a few staff who would be okay with additional responsibilities, but most staff are wanting to keep themselves and their families safe and try to make it through each day with the workload involved with change. Being able to offer online or outdoor activities is highly dependent on the situation at each school. Some schools have gone through extremely elevated levels of quarantine, which adds stress to the school. Other schools have not been as effective. So it's not sort of the same for all. Overall, and this includes elementary, middle, and high school, all levels have indicated that staff are feeling vulnerable with the rise in cases in Lethbridge. Several staff have been quarantined on a number of occasions and they are wanting to avoid further quarantine experiences. They're not desirous of changes that may involve more risk. There are exceptions to this perspective. In other words, and I'm sure you hear exceptions, and there's always, it'd be pretty difficult to say that 1,200 employees are going to have the same perspective, right? So there's certainly different perspectives, but I just give the overall perspective. Some schools are experiencing attendance challenges with parents becoming reluctant to send their children to school. There has been increasing pressure to make exceptions beyond the last pivot point to provide learning at home. This has worked with teachers who then end up doing delivery for both in school and at home. And that's sort of the perspective of the administrators at the different levels. And Morag and Mike, you helped gather some of this. Would that represent what we heard? Or all? Are schools ready to implement plans that consider the breadth of activities, timelines for implementation, protocols? And this is the same as before. Really, it's not the protocols that are difficult to implement because they're pretty straightforward. They're pretty laid out. What is difficult is the lack of value benefit of adding cohorts as well as deciding what activities should run. So that will always be difficult. Eventually, some would feel that they are ready for that, some would feel they're not ready for that. Some, again, is varying perspective. Some schools feel they could manage online activity if they had a staff member who wanted to move forward with an online activity without pressure. And the acknowledgement that should the situation change and become more challenging, the online activity that is not curricular may be paused. So I think, hearing some of the voice of, we might have someone who would be willing to do that, but certainly don't want people to feel pressured that they would have to do that. And sort of the acknowledgement that any outside activity, including online, could be paused at any time. What implication is the addition of cohorts have? Those all remain the same. We all know that when you add cohorts, it compounds the number of cases that happen because, of course, you've got students in different cohorts. So rather than just one cohort being affected, you've got 2 or 3 or 4 or however many cohorts they belong to. And the same as the next one. That stays the same as it's been in the last reports. So if there's cohorts, clubs, activities, whatever it may be, that are outside of the past cohorts, then of course you've got potential impact of 10 cohorts of students plus staff that would be affected. And so board governance considerations, of course, those are just the kinds of things that as a summary, when we put it on our website, we take a look at that the board is always considered as part of their discussion. So with that, are there, I turn it over to the board for questions or conversations?
Thank you, Cheryl. Are there any questions for Cheryl in this update? Clark?
Will this update be on our website? Is it on our website?
No, what we do, Clark, as I mentioned at the beginning, we don't put this entire update there because we would be infringing on copyright. We have too many graphs and things like that from other organizations. Like last month, we'll put a summary together with all of we'll pull the information without taking information from others. We'll give where people can find information from other sources, but we just give a summary rather than the full document.
Because we just had, it's a public meeting and it's been up there and nobody can see it. And we're reading it word for word sometimes. But I think as much as we possibly can, it should be on our website available to people if we're going to bring it up at a public meeting.
And we did that last month, Clark. We put a summary up on the website of all the information that was in the report.
So where is it on the website?
It is under COVID.
So COVID-19 information, and then there's what's it called, pandemic plan. Oh, thank you. Is it the daily checklist? Sorry, me off now. Pandemic planning, thank you. And then COVID-19 information. You can get that off the front page as well, can't you, Leanne? Yeah, there's a link there.
Yeah,
and then the decision-making guide, Clark, on the very top, that gets updated. And so following our last board meeting, a lot of the information that we, on the very top, what we discussed, that gets updated. And if there's different happenings at different schools and if significant shifts are happening, then that gets posted up there as well.
Okay, thanks.
Any other questions? I appreciated the update, and I think we've had a conversation about online activities a couple of times. Alison Peikeners and Bradley have come to the public forum portion to advocate for online activities. And I think I appreciated getting the perspective of the staff in this summary. And I know that there are some staff members that would be willing to implement it. But I think it is important to look at the broader picture. And I know moving forward, I think if this is a shift that we're considering, I think it's really important to lean on the fact that we don't want staff members to feel pressured in any way on top of the pressures that they're already feeling. Are there any other questions for Cheryl?
And so with that, we could move to, I know that the trustees asked me to ask that I bring back and you take a look at some possibilities for changes to the pandemic plan. And so that's I distributed the one page sheet. We can put that up on the screen as well, and I can go through and talk about some possibilities for the board. So, and I thought, a discussion of co-curricular and extracurricular activities, and so this seems really long to talk about co-curricular and extracurricular activities, but I think it's really helpful in making sure we understand, because I'm not sure that it's really clear across our public or parents as well, and perhaps it's the way that we've articulated our pandemic plan and our reentry plan. We have to remember the pandemic plan is not the reentry plan. The pandemic plan is the larger plan that guides the board in any pandemic. And so it's not specific to COVID, right? A pandemic plan is broad in nature, global in nature. In other words, it doesn't give specifics about a particular pandemic. Our reentry guide that was put together in August is very specific to COVID and includes all of the parameters that health services and education put on structuring schools for the 2020-2021 21 school year. And so keeping in mind that one of the main objectives of the pandemic plan is to define critical operations. That's the main objective of pandemic plan, is to define what is most critical in the organization. You'll see that with any organization's pandemic plan, whether it's a federal government or a provincial government or a company. What are the critical operations that that organization must address to keep operating? So really what's always being done is considering what's essential and non-essential. So the purpose of a pandemic plan really is to say, these things are essential, these things are non-essential. The pandemic plan considers all services offered by Lethbridge School Division and rates them as critical, vital, necessary, and desired. So in the pandemic plan, there's a chart in there, it's on the website, there's a chart and it takes all of our services and it breaks them down into those 4 categories. Desired services are those that can be delayed for 2 weeks or longer. That's how you know it's a desired service. For pandemic purposes, these are services that will be deemed as non-essential until such a time as either staff levels are back to normal and or priority necessitates. Currently, Lethbridge School Division plan reads on page 12, all co-curricular and extracurricular activities are considered non-essential. That's pretty obvious, right? Curricular, extracurricular, co-curricular are not essential to the operations of the school. It's not their essential core business. Then it furthers and prohibited once level 5 has been reached. Level 5 is if there's a pandemic in a geographic region and not just included. And level 6, which is global, and that's what COVID-19 is. This places safety of students, staff, and community as the first priority. The primary reason for categorizing services as essential and non-essential, including co-curricular and extracurricular activities in a pandemic plan, is to ensure that first of all, resources and staff focus on what is essential, because the capacity of staff is limited by the number of staff available to deliver services, as well as the additional burden staff carry due to additional tasks at work, as well as potentially added tasks in their homes caring for others. So that's the number 1 purpose, because really who takes care of the health pieces? Health takes care of the health pieces, and that's why we have a reentry plan, and that's why our reentry plan has all of those parameters that health identified as keeping people fit. Our primary purpose for our pandemic plan is to make sure that we remain operational. But we also want to make sure that there aren't additional health-related risks due to engagement with non-essential services. So that's the purpose of a pandemic plan. Now, although online co-curricular and extracurricular activities do not add health-related risks, they still need to be considered carefully in light of the first reason, that of diverting staff attention to non-essential services. The pandemic plan could be reworded to give consideration to online activities. So in other words, I don't think we need to say it's non-essential will always be, because I don't think anyone necessarily anticipated how long we would be in this situation, first of all, right? And certainly, really always needing to consider, are all the schools in the same situation? Are all the staff in the same situation? There may be a little bit of an open door and understanding a specific context that could happen. So I give an example of what could happen to open things up a little bit in the pandemic plan. Keeping in mind, we always have to remember the pandemic plan is not specific to COVID. That pandemic plan is built for any pandemic that happens. All co-curricular and extracurricular activities are considered non-essential and prohibited once level 5 has been reached. The exception, and you could add after that, you could add some clarification. The exception to prohibited co-curricular and extracurricular activities are those activities that can be delivered online. It must be kept in mind that these are still considered non-essential, and each school site will determine whether or not the circumstances at the school are such that there is staff capacity to manage the online activities. Online curricular, co-curricular, and extracurricular activities still require staff time and administrative attention to ensure appropriate parameters are in place, including membership restriction, if any, strategies to ensure digital citizenship and safety, and supervision that is structured in a manner that provides for close monitoring of the activity and interaction among club or team members and potential external audiences. And so what that would say basically is give that to the schools to decide, but as a board and as the board supporting a pandemic plan, be really clear that it's still considered non-essential. And that is not necessarily a right to have those things or something that a school has to offer, but it's something a school may choose to offer if they feel they have the capacity to do so. Then the board could also add, if you wanted to leave more flexibility for some other things, depending upon the length and nature of a pandemic at level 5 or 6, because again, I don't think anyone anticipated would happen this long. The board may consider other exceptions to prohibited activities, such as outdoor field trips in existing cohort structures and activities such as outdoor sport. If an exception is made by the board, these activities would follow all provincial health guidelines for engaging in any activity, as well as participation in such activities will require a signed acknowledgement of risk that will be provided by the school division. So what that does is, at least in the pandemic plan, recognizes that there may be a time that the board says, well, we think that because the trend is going down, or that we would allow outdoor activities in cohorts, or we could allow other kinds of things like that. And so those two paragraphs could be added, or something like that, or you may have entirely different ideas to the pandemic plan if the board wants to provide further flexibility of that plan. And keeping in mind that plan, remember, applies to COVID-19 certainly, but also is intended to be designed to apply to any pandemic.
Thank you, Cheryl. Are there any questions? Donna?
I just want to ask a question about this last little bit where you said outdoor field trips existing in cohort structures and activities such as outdoor sports. Are you saying outdoor sports in cohort structures or all outdoor sports?
That would be all outdoor sports. But again, I'm not suggesting this be done. I'm suggesting that if the board puts this in their pandemic plan, it's saying it could be given consideration. It's not saying that today, for example, that would happen, that there would be consideration given, depending on as the board deliberates each month.
Oh, sorry, Donna.
I just don't kind of like that wording. Just leaves it open for too many people to say, well, no, I think this is a good time, and maybe this isn't a good time. So I would like to look at that wording of that little piece.
Thank you, Donna. Got it.
Yes, just looking at that, the wording there, I agree that we need to look at that, because obviously there is going to be a time where we're going to be moving towards that. So to have something in place, even though we can't specifically say where or when, I like the fact that we're looking at that, because there is that, we have to have those steps in a general fashion. Appreciate the explanation about our pandemic plan. Again, I'm going to go back to my previous comment. It's just making sure our public understands the difference between the overall pandemic plan, because there's not very many people online listening today. And, it's clear that we need to have that for our general public, so they understand pandemic as opposed to what we're doing in our district level. And I like the direction I'm going now. Putting it in words and context is our next challenge.
Absolutely. One question that I would have, would this last paragraph be fitting in a reentry plan over a pandemic plan? Because it's more of a movement out. I mean, the co-curricular, extracurricular is adding a definition of the online, right? That's adding to an option. However, moving consideration into field trips and outdoor sport, that seems more of a re-entry plan things to me. Would that be a more fitting place?
All this is doing by putting it in the pandemic plan is acknowledging that could happen. That it could happen depending upon length and nature, right? So the pandemic plan, because basically the pandemic plan right now says it's prohibited. All co-curricular, extracurricular are non-essential, all co-curricular, extracurricular are prohibited. And so by putting this in the pandemic plan, you would have to, if you want to open it up, say in the fall to outdoor sport. I'm just giving you an example. Let's say you decide that, you know, things are under control, let's open up September to outdoor sport and or let's open up June to field trips to classes and cohorts. Whatever the board thought that might happen at that time, you wouldn't have to go back and change your pandemic plan, because the pandemic plan is saying that the board can give that consideration. So you wouldn't have to change the plan. You would get together and the board would make that decision, and then we could bring that decision to fruition, if you understand what I'm saying. This is giving, the first one basically, the online one is saying, really, if you put this in the pandemic plan, you're saying schools will decide online, right? That's what that paragraph states. The second paragraph with other activities is saying that depending upon the length and the nature, the board may give consideration to other activities, right? It's not saying that you've done that here, it's saying that you can give it consideration and that you might open that up. So you wouldn't have to go back and change the plan. Instead, you would say as a board, whether at a regular board meeting or a special board meeting, you would say, well, the board has made the decision based on the prerogative of the board to look at circumstances given by the pandemic plan to open up field trips in June for if the data remains the same for class cohorts, for example. You could do that without us having to go back and change the pandemic plan.
I see what Donna was saying though about, I think, when we actually name specific activities, it could trigger momentum for that specific activity. And I could be incorrect in that. What would your thoughts be in, I could see a space in saying, depending upon the length and nature of a pandemic, at level 5 or 6, the board may consider other exceptions to prohibited activities, period. If an exception is made by the board, these activities would follow all provincial health guidelines. And I think we can fill in what those specific activities are within your conversation within parent engagement in those. But I think to actually give the activity examples, I don't know that that would be wise. And then I could see that sitting in the pandemic. I think, yeah. Are there any thoughts or ideas? Tyler?
Which section of that are you in when you're talking about putting in the possibility of saying there can be other exemptions?
So if you take a look, Tyler, at page 12, in the pandemic plan. So do you have the pandemic plan there, Tyler?
Oh,
sorry,
yeah,
we should have sent you this document.
Okay, I will just say, I don't know the wording of it then, but I'll just say my concern. I don't think that we want to put things into a pandemic plan that says we may make an exception for all kinds of things. Or, basically a broad statement in a pandemic plan that says, oh, yeah, this is our pandemic plan, but we'll make exceptions for all kinds of things. I don't think that should be in the pandemic plan. Just because then we have people constantly coming saying, oh, well, you said you could make exceptions, and what about this, and what about this, and what about this, and what about this? So I don't know how it's worded now then, but that's my concern with saying something like that in the pandemic plan.
The pandemic plan as it is right now states that all co-curricular and extracurricular activities are prohibited. There's no exceptions.
Right, but Christine was just talking about putting some type of wording in there that says, oh, we may make exceptions for, whatever. I don't think we should have that kind of wording in there. I think a pandemic plan should have the wording that it does now. And if we want to make a specific exemption in our pandemic plan at this time, then I think we do, and we put that in, which frankly, now that I'm already on that topic, I do think we should put in an exemption for online activities as it is worded there. So I would like to see something like that go in, but I don't think we should add anything else about other exemptions in the pandemic plan.
Okay, thank you, Tyler. Sorry, I assumed you had the sheet and you don't have the sheet. Or you email it.
Yeah, Tyler, Ian's gonna email you the sheet. Sorry, I should have thought of that. You're at a disadvantage there not having the exact wording in front of you. I think.
Well, that's fine. It's my fault for, I was going to be in person and then I wasn't able to be in person, so I was last minute on Teams.
All good. Yeah, I do see what you're saying with that point, Tyler. Clark.
What Tyler, I'm confused at what Tyler's just saying. He's saying, don't put anything in there that says we can make exceptions. But I'd like to make an exception. So I don't think you can have both. I think Christine's wording allows us to make the exception that Tyler is suggesting we make. If we leave it as prohibited without any other wording, then how do we make exceptions? This is a board document. This is not a policy. This is a board document. It's up to us. We can do what we want with it. But it's a plan, and I think a plan has to have fluidity, has to have some flexibility, because we wrote this when H1N1 started, and we've adapted it since H1N1. So if we think that we wrote a document that shouldn't have some flexibility to it in 2010, I think that's ludicrous.
I think the way I'm seeing it, Clark, I think that adding the exception to online is different than adding the exception to being flexible to consider. Do you see what I'm saying?
No, I agree with what, I agree.
Okay.
I agree with your wording.
Yeah.
I agree with your wording, but we have to have something in there that allows us to alter this document, or else we shouldn't be able to alter this document. If we say that these things are prohibited, period, they're prohibited. And now we're looking at making a change because this thing's gone on for 13 months. And we're feeling like maybe there's some flexibility that should have been built into this unicorn of a document because we didn't know what was going to happen. And we're saying, well, maybe we won't change it. And I think what we're doing here to allow some flexibility in it is the right thing to do.
Okay, thank you, Clark. Jen.
Just looking at some of the information that Cheryl has provided here, I personally think that it really comes down to the staffing, and if there's staff that are willing and able to take part in some kind of an extracurricular activity, or whether it's online or whatever. By the looks of it, most staff members are not that eager. They've already got enough on their plate between what they're doing at school and their home life. But I think we need to be really conscious of our staff and the load that they've had for over a year.
Thank you, Jen. Donna.
Well, it seems to me that we review this pandemic plan about every couple of months. And if our numbers were really low right now, like I wish they were, I think that we would just say, okay, we're going to open for 2 days sports activities for the next 2 months without changing the pandemic plan. So I don't really think there needs to be much change in the pandemic plan. You can put online sports if you want into it, because we've never considered that. But as far as saying something that will make exceptions, we would make exceptions if we were really low right now. We would say, okay, without changing the plan. That's just my view.
So maybe my perspective on that is the exceptions are within the reentry plan then. That would be where the exception would be. That would be the where the moment. Am I correct? Am I correct in that, Cheryl? Can you explain this to me?
Well, the board for a year has been saying that the pandemic plan speaks to this, right? Yeah. And the pandemic plan, as it's written, doesn't give exception or doesn't convey the idea that the board can make exceptions, right? I mean, if you want the pandemic plan to reflect on what it is that the board would like to do in practice, then the pandemic plan should reflect what the board wants to do in practice. And it is a document that the board document, you can make whatever changes you like to it. And certainly you could, I mean, it's either, I mean, it's 6 of one perhaps and half a dozen of the other. So you're right, you could, the board could come back and say, through a board motion, we will make an exception to the pandemic plan by allowing for whatever it might be. Or you can have the pandemic plan that the board can make exceptions depending upon the length and nature of the plan and other considerations. And if that's written in the plan, then it's recognized by the board that part of your role throughout a pandemic is making decisions about exceptions. And so certainly that's what the board has been doing for a number of months now as we bring information to the board. The part of the primary purpose of bringing information to the board has been to inform your decision making about levels of activity that you may or may not consider as happening in schools and as part of the reentry plan. So let's say you were to offer outdoor field trips, then yes, that would be put in the reentry plan. The pandemic plan doesn't change at all, it just stays the same, right?
Thank you, Cheryl. Doug.
That is the difficulty of what we're trying to achieve here. Because with any pandemic, there's so many exceptions, and it's based on case counts. It's based on outside factors, vaccines that are available or not available, you know, depending on our numbers. So I believe there has to be the exception, but like maybe what Cheryl's saying, I think Clark's saying, he said, you know, is it one or the other? We got to have that, but the reentry, maybe that's our go-to segue to in the event that there's an exception. These are our steps that we could go to, because I think the public are looking for that, because what we know today and what we will know in 2 weeks, we're not sure. And if the numbers start to plummet, obviously we're going to look at a reentry plan if it keeps going down. But if it doesn't, we have our basic plan that we can rely on, as we know. I think it's just really clear to the public that what we really want is safety first, but we also want to get back to a normal setting. But those steps are critical, and sometimes our hands are bound by Alberta Health Services. It's like, you can't go there. However, if we do have some steps in, which we're trying to achieve here, I think the reentry steps are, in the event that things are changing, essential and non-essential, may change as far as priority. And I think that's the key with the flexibility with our board. We have to be flexible because the pandemic is very flexible and going up or down.
Thank you, Doug. Tyler, and then Donna.
Well, I just had a bit of a question then, how the reentry plan relates to the pandemic plan. Just because if the pandemic plan says one thing and the reentry plan says another, does the reentry plan come into place? Like, does the pandemic plan cease when the reentry plan comes into place? Or how does that work? Or are these two things operating at the same time, and then the reentry plan essentially overrules the pandemic plan because it's got what we're currently doing? That makes sense?
It's a good question, Tyler. And so the pandemic plan should guide overall board decision making in any pandemic. It's not specific to a pandemic. So if you add, for example, Tyler, the online in the pandemic plan, then that's done and it's part of the reentry plan. If you don't add other exceptions in the pandemic plan, then really the pandemic plan should supersede the reentry plan. The reentry plan gives details for a specific pandemic. So a reentry plan at H1N1 might look different than a reentry plan with COVID-19, would look a different reentry plan with any other pandemic, because it's specific to that pandemic, specific to the mandates that Alberta Health Services and or Alberta Education has provided. And it outlines in a very clear operational manner, right? It's operational, exactly what needs to be done and followed in the school division. If the pandemic plan states that the board may consider other exceptions, that's without giving examples. I think that's very, without giving examples of those, then the reentry guide then can be more specific about how is it that what are some considerations that the board gives if they are going to give exceptions to co-curricular and extracurricular activities. But then you don't have to go back and change, or you don't have to say, we're not following our pandemic plan, we're going to allow for these things. Your pandemic plan says that it may be given consideration. And then the board can say, well, given the data that we've received, we're not considering. Or the board may say, given the data that we're seeing, I think we're ready to allow for outdoor field trips, for example, right? Then the board can say that without going back and changing the pandemic plan. The pandemic plan is the umbrella. The reentry plan falls underneath of that and gives the specific operational pieces of how we operate the school division and what are all the rules that we have to operate provided by different organizations. Does that make sense, Tyler?
It does, okay, and if that's the way it's gonna run, then yeah, I can live with basically just saying that we can make for exceptions in there. In that sense, it makes sense.
Thank you, Donna. What about adding something about the board can go to re-entry under these circumstances in the pandemic plan? What about just a statement about moving to re-entry at maybe time, whatever? Or how many cases?
How would
Is there
pandemic
is there a
limit?
Is there, I don't know, in the pandemic plan, would you like a final statement of, the board could say, consider re-entry? I don't know, I'm just asking, would that fit well into that?
Or you could say, if an exception is made by the board, these activities would follow all provincial health guidelines for engaging in any activity, as well as anything outlined in the board's re-entry plan, that's right? We could add on to that? Actually, that should go first. If an exception is made by the board, these activities would follow all guidelines outlined in the re-entry plan, as well as all provincial. Does that make sense? Because the re-entry plan is flexible. Like the re-entry plan changes all the time, right? Because it keeps up with Alberta Health Services and keeps up with those kinds of guidelines. So
Sorry,
we've got the wording right there. Engagement in exceptions made by a board. These activities would follow all guidelines outlined in the board's re-entry plan, as well as the provincial guidelines. And the board in any pandemic situation will have a re-entry plan, right? So this re-entry plan is specific to COVID-19, but if it was a different pandemic and 3 years from now, there'd be a different re-entry plan that's specific to that pandemic. So that makes good sense, because every pandemic is unique. You're going to have different kinds of guidelines, so it makes sense to make reference to the re-entry plan there. Yeah.
Thank you. Leanne, should I read off there was a question in the chat. It was sent directly to you? Okay, then I will let you answer that. Okay, then I will let you answer that. That is all right. Thank you. Well, I definitely see the appreciation for adding a piece of flexibility. I mean, for example, if numbers were low enough and Alberta Health said, okay, for example, swimming pools to be opened, I would love to be able to say to a class cohort, book a pool for an hour. It would be great to be able to provide that kind of opportunity, should the timing allow. And I think adding this last paragraph will allow for that flexibility for those kinds of activities, or outdoor field trips to Henderson Lake, for example. I mean, right now, without this, classes would not be able to participate in those kind of activities. So I definitely see the benefit of this final paragraph. Doug?
Writing down the reentry plan or developing it, I know we have parts of it, this and that. I guess I would encourage that we try to have something before the end of June. The reason being there could be major changes coming along throughout the summer, and to have at least something. I know we do have a few things in place, but we've got a little bit more structure to that, and then it's available. Just a thought, because we're all hoping about some form of reentry in September, and it would be nice to have this for us to discuss, at least at our not this board meeting, but maybe upcoming one with the next one. Right?
Thank you, Doug. All right, we have two potential changes to our pandemic plan. Are there any other questions or comments? Well, I will bring up the paragraph on extracurricular activities and online activities. As the paragraph is written, is the board supportive of this piece being added to the pandemic plan? Is this something that you would like to pursue today, or would you like Cheryl to work on the wording and bring it back to us in 2 weeks at our next board meeting for approval? Donna?
I'd like it to come into the board meeting for approval.
All right, is everyone supportive of that? All right, so Tyler.
I would just question why we would send it to the board meeting for approval, because we're in a board meeting right now. Is there something else that needs to be, like if there's nothing else that needs to be vetted out or worded or anything else, I would suggest we just approve it today, because we are in a board meeting. So I don't see the use in waiting until the next board meeting.
I wasn't sure that they had the last statement that we were going to put in what they were comfortable with the wording on that one.
Okay, so, yeah, just now I was just talking about the online delivery.
Yeah, this one's just the online
activity. This is just
activity.
the online delivery. So if someone would like to make a motion to accept.
Can you maybe read the how the statement as it stands right now?
Sorry, say that again, Tyler?
Could you maybe read the wording as it stands right now for the online?
Yep. The exception to prohibited co-curricular and extracurricular activities are those activities that can be delivered online. It must be kept in mind that these are still considered as non-essential, and each school site will determine whether or not the circumstances at the school are such that there is staff capacity to manage the online activities. Online co-curricular and extracurricular activities still require staff time and administrative attention to ensure appropriate parameters are in place, including membership restrictions, if any, strategies to ensure digital citizenship and safety, and supervision that is structured in a manner that provides for close monitoring of the activity and interaction among club/team members and potential external audiences. That's
okay. I would like to move addition of that statement to the pandemic plan.
Thank you. Any further discussion? Call the question, all in favor? So carried, we will add online activities to our pandemic plan. Is somebody wanting to put a motion forward on the final paragraph regarding exceptions? Donna?
I'll move that we put it in the pandemic plan as well, just want it to be read.
I'll have Cheryl read what she has.
I'll read what I have, so if I have it incorrect, you can certainly let me know. Depending upon the length and nature of a pandemic at level 5 or 6, the board may consider other exceptions to prohibited activities. If an exception is made by the board, these activities would follow all guidelines outlined in the reentry plan specific to the pandemic, as well as all provincial health guidelines for engaging in any activity, period. Student participation in such activities will require a signed acknowledgement of risk that will be provided by the school division.
Thank you, Cheryl. Do we need to specify that it's the division reentry plan?
Yes.
All right, Cheryl has read the statement. We need a motion to accept. Okay, oh, sorry, thank you. Sorry, my apologies, Donna. Thank you. Any further discussion? Seeing none, call the question. All in favor? So carried. Thank you. This will also be added to our pandemic plan. Good work today. Thank you.
Thank you, Cheryl.
All right, next on our agenda, we have our budget updates. I'm going to hand this over to Christine Lane.
Hi, thank you very much. So on February 25th, we had the provincial budget announcement. And then on March 31st, the division received its funding profile. Between then and now, we've had a number of discussions with the instructional budget committee to try and figure out how we were going to allocate funding based on our funding profile and the funding model for the instructional budget, as well as looking at the funding pieces for the other pieces of the budget pie. As this information is still in draft and preliminary discussions are not ready for an actual public presentation yet, I would request that we move this discussion internally.
Thank you, Christine. Can we have a motion to move in camera, please? Oh, okay. Oh, he wanted it. No, okay. Thank you, Cheryl. Can I have a motion to move in camera, please? Clark. All right, call the question, all in favor? So carried. We will now move to in camera and return to our public portion of our meeting when we conclude.